In Andhra Pradesh, surgeries by Ayurveda doctors. Is it a bold step or a risky move? On 23rd of December, Andhra Pradesh's Health and Family Welfare Minister Satya Yadav cleared a proposal giving approval to Ayurveda practitioners to perform 58 surgical procedures. There is, of course, a precondition to all this, of course, granting the approval as it were, and that being that it is incumbent upon Ayurveda practitioners to have completed postgraduate training in surgical disciplines along with the prescribed clinical exposure. The approved procedures include general surgery, ENT and ophthalmology, and are set to be permitted under existing central regulations. But then, the Indian Medical Association, IMA, has lodged their protest against this approval, warning that it could compromise patients' safety. The approval follows provisions under the Indian Medicine Central Council Regulations 2020 and guidelines issued by the National Commission for Indian Systems of Medicines. It applies to Ayurveda practitioners who meet the specified eligibility criteria. Now let's understand what kind of surgeries have been approved for Ayurveda practitioners. The procedures are categorized under Shalya Tantra, which covers general surgery, and Shalakya Tantra, which includes ENT and ophthalmology. Under Shalya Tantra, Ayurveda practitioners can perform 39 general surgical procedures, which include wound debridement, abscess drainage, skin grafting, suturing, and the treatment of piles, fissures, and fistulae, as also some abdominal emergency, if the case be. Now, under Shalakya Tantra, 19 ENT, eye, and dental procedures have been permitted. But the IMA is not convinced, and their objections are not towards Ayurveda as an ancient science, but about giving Ayurvedic doctors permission to perform surgeries which the IMA feels requires skills and precisions and, most importantly, practice. But then the Health Minister, Yadav of Andhra Pradesh, said that the move actually aligns with Indian systems of medicine with regulated surgical practice and training frameworks. In recent times, ladies and gentlemen, there have been several slugfests between Ayurveda, Siddha and naturopathy versus English medicine. Even with surgeries, many quote Sushruta, who is considered to be the father of surgeries. So where do we stand? What happens to those patients in Andhra Pradesh? We don't want to create panic, please. Andhra Pradesh is a responsible state, but let's go across to the experts and understand what is really going on. I am very, very delighted to welcome Dr. Dilip Bhanusali, who is the National President of IMA, and Nallamuthu Chakravarti, who is a political analyst and President at the Center for Liberty. Merry Christmas to both of you gentlemen. Thank you for making the time.
Merry Christmas, Sudhaji.
Thank you very much, and making the time today on a day of festival. Nallamuthu, let me start with you. If you talk politics, one does understand that, they are, the government in Andhra Pradesh is, it's TDP, it's, of course, Janasena Party, and it is BJP. It is part of the NDA, the conglomerate, for lack of any other word. And obviously, because there were permissions granted from 2020, but Minister Satya Yadav says the previous government did nothing and we decided to do this, and also there is plan to open several Ayurveda clinics across the state. But to permit surgeries now, Nallamuthu Chakravarti, South has one of the best healthcare system. I do not know if doctor is going to accept that, but I have data with me. How do you look at this step of allowing them to perform surgeries now, Nallamuthu Chakravarti?
Sudhaji, so I think this is less of a political issue in the sense that both the parties, the prior government under YCP and the current coalition government, have supported Ayush. It is the prior past government that has built 2 Ayush hospitals with surgical capabilities. And the TDP government is now rushing to finish them off. I think one of the hospitals, either in Kakinada or Vizag, was 90% completed. And the second hospital is probably halfway through, and the government is trying to finish it. So there is no question that South India has, one of the best treatment networks, especially in the metro cities. But the biggest problem right now, the crisis, is in the rural areas where access to care is quite difficult. So if the government gives people a choice with transparency, we don't want Ayurvedic doctors to display saying they're, regular allopathy surgical doctors, but as far as there is transparency and they get proper training, and as you have said in the beginning, they are going through, these are not, regular bachelor degree, but it's a master degree with 3 years of training in surgery. And if they're allowed to do certain basic procedures, I think it would help the rural population to get the care that they sorely lack. Prior to this program, I quickly looked up, what is our surgeon availability. If you look at the United States, for every 1 lakh people, there are for 100,000, yeah, that's 1 lakh, is 50 to 60 surgeons in the United States. Germany has 125, China has 15 to 25, whereas India only has 5 to 10 surgeons for every 1 lakh. So we are woefully inadequate in terms of number of surgeons.
Yeah, Nallamuthu, I do hear you. First of all, giving health care to rural people is the responsibility of the elected government, and they should do due diligence. I would say I am a great believer in English medicine. Because if I have some problem, I rush to the hospital, I don't go to the naturopath. As a palliative, I will. I want to understand, Nallamuthu, why should the rural people be put in the hands of people? I respect Ayurveda. After all, we all came from there, right? The household kind of treatments, which in the south is still extremely popular. But the point is that will I put my child in the hands of a doctor and see to it that, as and when it happens, he has experience and maybe my child has an eye problem because ENT is included in this? I will not. The government is supposed to give. Now they are going for P&P, partnership for hospitals. Andhra Pradesh is doing that. Neighboring state Kerala, superb healthcare for rural areas because the government insists that the rich people can still be privileged. What about those? And they are unlettered also in most cases. So I don't buy this at all, that it is very good for rural, people. I'll come back to you, Nallamuthu. Thank you for your opening comments. Dr. Dilip Bhanushali, I read your comments. You say this is bordering on quackery, sir. But the thing is that it is only for those practitioners, sir, who are postgraduates and who've had some kind of training in surgery, and they are being given what is called generic surgeries, But I do not know what generic means. Yeah, maybe if you stitch me up here, it is generic. But if I have a baby and you're stitching me up after a C-section, I don't think that is generic. Both are sutures, right? Now, I'm not a doctor, but I'm asking you, Dr. Bhanushali, why do you call it quackery and why have you vehemently rejected this proposal, sir?
Good evening. Merry Christmas to Sudhaji and the viewers.
Thank you, sir.
I have been fighting this mixopathy for last 1 decade. We are not against any pathy. In fact, we are not against Ayurveda, neither we are against homeopathy or Siddha. Ayurveda is there for thousands of years, been practiced a long history of Ayurveda. But what we want is it should maintain its purity. Why do you want to mix it? Let the government propagate Ayurveda in all its forms, in its pure form. Why they want to mix with modern medicine? Now, let me tell you, to become a surgeon, it takes almost 10 years. 5.5 years of MBBS and then surgery for 3 years. It takes almost 10 years to become a surgeon who can perform all these operations what they have mentioned. You suddenly make him a surgeon, an Ayurveda doctor, giving a training for 3 months, 3 years, and you ask him, you are putting risk, the patient are put at risk because surgery is just not training. It requires a lot of training, not only practical training. It has to be the post-operative complications, the indications. So how are they justified in doing this?
Sorry to interject, but then these postgraduate practitioners have had training in surgery. That is the condition. That is what the minister says. These are trained practitioners who had training in surgery, sir.
Or 3 months, how just training? What about the theory part of it? What about the practical part of it?
You make a very, very valid point because like even in my introduction, I said most important is practice. And also if there are complications, how to handle that complication. Sometimes a very small operation can also go out of people's hands. I've seen that, many cases like that. So let me come back to you, sir. Nallamuthu Chakravarti, tell me something that if you have, you are, if I'm trained in being a journalist, but I've never been to the field and reported, I don't think that I would require some kind of hands-on, that's what we call, you must know this, hands-on experience. I just don't understand. I see more politics in this than anything else. I have no fight with Siddha, no fight with naturopathy, no fight with Ayurveda. But mixing the two, like doctor says, is a bit of a risk, isn't it? I mean, how are we going to... letters have been written to the Prime Minister, the doc will bear me out. They've been written, and our Prime Minister, being who he is, who also believes in the scientific temper in this country, apparently there's been no response. I'm sure he will give a response. But Nallamuthu Chakravarti, this is experimentation and this is with people's lives, I say.
No, it's not. It's not. Dr. Dilip seems to think English medicine has monopoly over these procedures. At the beginning, in your monologue, in your introduction, Sudhaji, you mentioned Sushruta. He is the father of surgery, globally accepted, and is also father of plastic surgery. He's from 600 BC. He had done 300 procedures. This is in 600 BC, including cataract, C-sections, bladder stone removals. So we have given the world the wisdom and meticulously documented. Sushruta has meticulously documented, and those palm leaf manuscripts exist to this day in Germany, in Oxford University. So to think that somehow English medicine has monopoly over these surgical procedures is not right. Now, the concern is whether they are properly trained to do the treatment. And the English medicine and during the British rule, our traditional medicines have been methodically been discriminated and been sidelined. So it is a matter of how do we bring them up to speed. So these colleges are being set up, 3-year programs where they're trained in these procedures. And if they have to, handheld for a while, we should. But to treat them as completely, they're only there to give some herbal medicine and leave it out is not right. So if the concern is valid, then we need to figure out a way to bring them up to speed, to give them practical experience in terms of doing these procedures. But the last point was where you earlier, Sudhaji, mentioned, how could you put rural population through this kind of untested medicine? Today, I live in rural India for 12 years. It's a matter of not getting any treatment or getting some doctors. See, they go to an RMP who is not even qualified. There is no such thing called RMP. They just self-declare themselves as RMP in rural areas. And somebody goes with some condition and they treat. They have no license, no training, no nothing.
Right.
I mean, this person
There are
has
ASHA
4 years of
workers.
undergrad and 3 years of degree. This is better than nothing.
I'm sure you've lived in a rural area, so have I. But you speak English and so do I. You drive, I'm sure, so do I. We have access.
I'm saying rural people
I
having
cannot.
somebody
Tribals,
who has
I've
7 years
also,
of training.
I have also lived with tribals doing a story. They have nothing. They go in a dolly when she is having labor pain. I don't have to. I have a jeep. I just take her in my jeep to the nearest primary health center. Yes, is there a problem of access and problem of somebody who's available? Sure. But I'm going to ask you something and, sorry, and if you don't want to answer it, don't. Will you take your loved one to an Ayurvedic doctor for, let us say, even putting sutures on the forehead, or you will go to ER? Emergency.
That's a wonderful question. That's a wonderful question, Sudhaji. If I'm stuck in a forest where there is nobody to treat my child, I'll go to an Ayurvedic doctor in the absence of anything else. That is exactly what is happening in rural areas. You don't have anybody. And when you don't have anybody, yes, I will take my child rather than just leaving him to suffer. Absolutely.
So, and let me go to Dr. Dilip Bhanushali. Doctor, you heard all this and you said, he says, you make it out as if English medicine has the monopoly. I believe in English medicine. I'm sticking my neck out. There was one time when there was consumption, that is tuberculosis, thanks to English medicine. Thanks to English medicine that we have, completely eradicated, at least nearly, polio. What about, smallpox? All the other diseases. It's thanks to the research which has been conducted. But the thing is, again, I am not belittling Ayurveda. But do you think just because we don't have an RMP in rural areas, we can have these Ayurveda doctors sitting there? And my whole problem, Dr. Saab, is that they have no practical experience, sir. Dr. Bhanushali, please unmute.
Yeah.
sir.
Are you able to hear me?
Yes, I am, sir. Go ahead.
Yeah. Okay. Now, coming to your point that we haven't taken the monopoly. That's what I'm saying. Modern medicine should be left alone with its own this thing. If they are promoting Ayurveda, let it be there in the pure form. You tell me 98% of the Ayurveda people, they practice modern medicine. They write modern medicine. I think you should agree on that. None of them write Ayurvedic medicine to their patients. Now, what is this?
Why is
Is
that?
it not quackery?
No, why is that? I've been to an Ayurveda center in New Delhi with someone. We were given pudiyas and we were given some tonic to drink. None of them, no pills were given, sir.
No, but then if they go to that Ayurvedic hospital, I'm telling you in general, the practitioners who practice both in the 2-tier, 3-tier cities
Yes, sir.
in the urban areas, they practice the modern medicine.
Right. Okay. So
They're
you
not
are
practicing that.
so you are totally against this, whereas Nallamuthu says it's a good idea. Something is better than nothing. Dr.
If you allow me
Bhanushali.
to quickly respond to that, Sudhaji. Sorry. What is medicine in pure form? Medicine is something, it's an evolving science. Let others also do, their own
No,
bit.
no,
And if they
I
find
don't
the
agree.
combination.
No, I don't agree. Nallamuthu, please, I'm sorry, I don't. You cannot experiment with people's lives. You can't say, let's see what happens.
No, let people give people a choice.
No.
Let people decide. If I
No,
want to go to
because
an
those
Ayurveda doctor, I'll
those
go to an
rural
Ayurveda
folks,
doctor.
the rural
How can you
folks
impose?
do not have a choice. They will go to
They
whoever the
do,
government,
they
they
do.
don't. You just now
They
said
do.
no,
You
they
just
don't.
need to put Sudhaji. We can stipulate that an Ayurvedic doctor does a full disclosure of what kind of training he has. An MS in Ayurveda medical surgery. He can put a board,
Yeah,
and
you
people have a
think
choice whether to go or
a
not.
rural folk
Give people a
understands
choice.
what the
Why
difference
are we
between
deciding?
Nallamuthu,
No,
do you
ma'am.
think?
Why are we deciding
No,
what
no.
who
How
they
does
should
a
go to? Give them a
rural
degree and
person
let them
decide
practice.
whether he's an MBBS, MD, or FRCS? He doesn't know. He's a doctor, sahab. He's God. That's all he knows.